I've recommended this option for your treatment because you failed medications and it's the on-demand erection that you need. During the procedure, you're brought into the operating room and you're intubated and put to sleep. We then make a small incision and place a reservoir within the abdomen. We then measure and size the penis or the cylinders that are placed within the penis so it's an exact fit. We then place a pump within the scrotum and connect all of the tubing. After all the tubing is connected, we test the inflatable penile implant to ensure that it's working for you. We then close the incision. We place our drain within the incision. We then place a wrap on the penis and you are woken up. This is typically an outpatient procedure where you go home the same day. In some instances, you may spend the night. Prior to surgery, you see a primary care physician, or if you have cardiovascular issues, you may see a cardiologist for preoperative risk stratification. After they've given you clearance and said that it's safe to put you to sleep and do the procedure, you're then cleared and we can bring you to the operating room within a week or two. You do need to arrange for transportation because after you wake up from anesthesia, somebody needs to drive you home safely. Prior to your procedure, in some patients, we'll have you using a vacuum erection device. Most patients will be asked to use an antibiotic scrub. Some patients will need to stop or change the medications that they take. This will be determined by the primary care physician or the cardiologist that they see prior to being brought to the operating room. Typically, we have patients not eat or drink anything starting the midnight prior to their surgery. After the procedure, once the patient has woken up, you can eat or drink whatever you'd like. On the day of surgery, you just need to show up at not having eaten after midnight and bring a friend or family member who can drive you home safely after the procedure. Prior to the surgery, you don't need to shave. Any shaving that needs to be done will be done in the operating room by the operating room staff. The day of surgery, you're brought to the preoperative area where you'll be seen by me and we'll talk about the procedure and sign the consent. You'll then be brought to the operating room where you'll be put to sleep. We'll then do the procedure. After the procedure is complete, you'll be brought to the post-anesthesia care unit where you'll be awoken safely, and then you can go home with a family member or loved one. If you're feeling nervous before the procedure, that's completely normal. I encourage you to reach out to friends, family members, or my clinical staff, and they can answer all of your questions. We also have a list of patients who have had this procedure before and can answer your questions from a patient perspective about what to expect with a procedure like this. If you have questions before the surgery, you can always call my clinic staff and they can answer your questions, or you can reach out to the patients on our list who have already had the procedure and they may be able to answer your questions from a patient perspective.